of this COVID-19, I never expected to be in such a position, but it happened that I am one of the victims. My profession is I'm a social worker. I'm one of the frontline staff, as it is explained. It started on the 18th of March. I was at work and I just started feeling cold, shivering around 3 p.m. I came back home and I was just following what other people were saying before it affected most people. That if you drink lemon, if you drink ginger, if you drink whatever sorts of things, I was doing it before I got ill. So I came home and I mixed ginger, garlic, lemon, honey, and I used all that. On top of that, I also used cocodamol. I slept well. On the following day, I wake up feeling well, no shivering, no what. I went back to work around the same time, around 3. I started feeling the same feelings. Came back home, did as I did the previous night, and I slept well. But that night I sweated like I don't know, to the extent that blankets were wet. Friday, I went to work. The whole day I could not feel anything. I am someone who is very active. Most of the time I get in the gym. I walk on daily basis. I use my lunch breaks at work on walks. So I'm someone who is very fit and active. That Friday, I came home, changed into my training gear, went out running, came back home. I slept well. Then Saturday, I did the same. When I came back in the morning, I started feeling abdominal pains. That shivering and coldness had gone. So from that day until the 26th, I was experiencing abdominal pains. There was no shivering. There was no any other sign, any symptom that could be linked to COVID. So on the 26th, and I could say from the 21st, something just told my spirit that it might be COVID. And I started isolating myself, pushing away my family, my wife being somewhere. We just started putting precautions in place. So on the 26th, in the evening, I felt that cold came back and I was shivering. I called the NHS 111. They advised me that this was giving them were not linked to COVID. So they advised they would call me within 24 hours. They called around the 4:30 Friday morning. That was on the 27th. And I was advised again, whatever I was explaining to them, that it could not be linked to COVID. But they referred me to one of the senior clinicians at Basildon Hospital, who called around 7:30 in the morning on the 27th. I explained to them, and I was really in pain. The whole night I could not sleep. They asked me to call to my GP for medical examination. They didn't tell me that GPs were not opening, and to myself, I never thought about it. So I woke up and walked to the surgery, which is about 5-10 minutes away from my house. I could not drive. I just decided to walk. Soon I got there, I was shivering, sweating. I could not stand. I got there around 3 minutes to 8, but I could not wait even a minute. How I was feeling. I knocked, and the nurse poked through the window and told me to go back home and call NHS 111. I tried to explain to them, NHS were the ones who advised me to come and see the GP. I don't even know how that conversation ended. I only woke up possibly after 5 to 10 minutes, realizing myself I was on the floor, leaning against the wall. I was still sweating, shivering, and one of the Nigerian girls, women who was behind me, was on the phone. In few minutes time, ambulance came. They checked me, they checked my temperature, they said it was okay. They checked the BP, it was okay. They took me in the ambulance and did ECG, and they said it was okay. I was advised to come back home. So I came back home. I spent the whole day not even feeling well. I could say from the 21st, my appetite, I was losing appetite. And one of the things that I could not take at all is something with salt. As soon as I put my tongue on something that sounded like salt, I could hear my whole body shivering. I'm sure we all understand Shona here. If there's someone who doesn't understand Shona, might ask. I was feeling like someone arumwa nechirize or munyaviri. So I could not tolerate anything with salt. So when I got back home on that Friday, I spent the night at home. Saturday, I woke up and I told my wife I could not take it anymore. She should take me to A&E. I went to A&E. They did all the tests, X-ray, chest X-ray. As I was complaining of abdominal pain, they did the stomach X-ray. They did my urine test. Everything was negative. I was told to come back home. That was on a Saturday. I came back home. That evening, that's when I started coughing, having a dry cough. My chest was like puffed up. And Sunday, the whole day, I was like that. In the evening, I could not breathe. I was on my own in my bedroom. My wife was away. I could not call anybody. Fortunately enough, my wife came in while I was just lying. My head was like falling on the other side of the bed. I could not get back on the bed. I didn't have that energy. She called the ambulance and they came. As soon as they came in, they did their test and they told me, they asked me if I was diabetic. I said no. They told me my blood sugar was 2.1, which they said was very low. My temperature was almost 39. BP was high. And they advised me they were taking me to hospital. I walked down the stairs with their aid because they could not bring it. So I got, as soon as I was trying to get in the ambulance, I collapsed. And they rubbed me in. By then, they put me on oxygen, on drip. I was taken to hospital. To be honest, I can't remember what happened between that time, Sunday evening, until the following day, Monday. They did the tests. I wasn't aware of whatever they were doing until they came, the 3 doctors came and advised me that all the symptoms I was showing through their tests were linked to COVID. After a day, they came with the results and confirmed that I had COVID. They were not going to discharge me, but to keep me in hospital for some days. So I was kept in hospital until the 5th of, from the 29th of March to the 5th of April. That is 8 days in hospital. And soon I was discharged. I came back home, but I still felt the chest was not yet healed. I was still coughing. It took me 2 weeks for that coughing to stop. They gave me some antibiotics and other medication to take with me back home. So I spent almost 2 weeks. I could not, as soon as I opened my mouth to talk, I would start coughing. And it took me almost 2 months to be back to normal and get back to work. But it was a difficult experience. I am 49 years now. I've never been hospitalized in my life. And it was the first experience. Thank you all. If there is anyone who has got a question, you are welcome.
And thank you, Mr. Mariwanku. We open the floor for questions to Mr. Mariwanku if you want some explanation as to his experience, and maybe as the first question, what advice would you give to our communities, those who don't have how do we our lifestyle that will help us in the case we get COVID-19?
The first thing I would want to advise is, as I was in hospital, I was making some observations. For the 8 days I was in hospital, I could say over 90% of the staffing who were attending to me were Black minority. Yet we are living in a country whereby we are possibly the Black minority population, we might be 1%. But the staff who looked after me during that time, I could say more than 90% were Black minority. So my view, and I managed to speak to some of them who were from Locum, and they were telling me their experiences. I could feel they were moving from one hospital to the other, from one job to the other. My own view is one of the things that is affecting our community. We're not giving ourselves rest. We are not taking enough precautions to help ourselves from this situation. I'm not so sure whether I answered your question, Mr. Chigodoro.
You answered it quite perfectly. Anyone who have got questions for Mr. Mariwanku? You can raise your hand, then I can unmute you. All right, Mr. Chipato.
Thank you, Mr. Mariwanku. With regards to the experiences you've gone through, obviously we are at a stage where this virus hasn't got a vaccine or a cure, and you've gone through it. You've recovered. You are now back in work. Are there, or has anybody spoken to you about recontamination or having got the illness before? What are the chances of you getting it again, or do you just maintain the normal precaution as somebody who hasn't been affected before?
At the moment, I'm maintaining all the precautions that I've been taking. Thankfully, I thank God, because we started taking precautions. I was in fear that possibly my family would have got it, but we managed to take precautions from the onset of my illness, and that might have helped. And because of the illness, I am someone who is following most of the events from different countries, news. If I am at home, I spend 90% of my time following up on what is the researches that are being done, and whatever other people are saying. At the moment, it seems there's no cure, there's no vaccine, one. And they are saying there is no proof that those who cannot get it again, even though their immune might be in a better position to fight it. But there's a possibility that I can get it as well. So if I go out in public, I always go out with my mask. I have my mask in my car, I have my gloves. Even my wife, she has the same in her car. Whenever we go out, if we get into congested places, we put them on just to protect ourselves.
Thank you.
I'm not so sure if I answered you.
Yes, I think I'm okay with that response. Thank you.
Anyone with any other question before we move on? You can raise your hand, then I can unmute you. Right, Mr. Nera.
Hello.
Mr. Nera.
Thank you, Mr. Mariwangu, for sharing your experiences with us. My question is with regard to the 111 service, whereupon they indicated to you that you did not have any COVID-19 symptoms. What is your comment regarding your experience with the 111 service? Thank you.
But I could say I'm one of the earliest people to be affected by this. My experience and my observation from what was happening, there was no clear guidance. Because the very first person whom I spoke to told me was neither a nurse nor a carer, was a volunteer to answer calls. We had no information and even no knowledge about what was going on. The second caller who called me in the morning was a clinician, a senior nurse, but she could not give me the right advice until to the third person who advised me to contact my GP or visit my GP. They had no enough information by then.
Thank you.
Dr. Chireka, you had a question?
Thank you very much, Mr. Moran. It's Mwari, isn't it?
Yes.
Yes, okay. Thank you very much. No, it's really humbling and it's good that you're sharing with us. And I know I can share, try to empathize with you. And you're right in saying that you are one of the first cases because then there was confusion. No one knew what this disease was all about. And the guideline was not clear. It was only looking for cough. So you did not have cough, so you don't have COVID. Which is wrong. And now we've realized that that was the mistake. And I'm happy, and I thank God that you have gone through this torture. I would call it torture because being collapsing at a surgery, and then going to the hospital and sent back home, and then going again, get sent back home, and then going the third time was just unacceptable, and it's so sad. And spending 8 days in the hospital. Yeah, I think this shows that that is the challenge. My question is only on your family. Did I get you right that none of your family members were infected? Is that right?
Yes.
Yeah, amazing, amazing. No, we thank God, and also we thank you for maintaining strict self-isolation on that.
Yeah,
well
it
done.
really helped. I maintained self-isolation from 4 days after I started feeling the symptoms. And it's something amazing. I don't know how to express it, but it is torture psychologically. Because day in, day out, my mind was just saying or praying to God that it wasn't going to affect either of my family members. And it happened like that.
No, we thank God. No, we thank God. And thank you very much for sharing. We have opened us a lot in a lot of these things. The way, or sometimes people talk of the symptoms. The symptoms that we talk about are textbook, but people are not textbooks. People do respond differently. And your case is that example whereby you were not fitting the textbook classification or definition, but you had COVID.
Thank you very much, Mr. Mariwangu, for sharing your experience. And I think we might have picked one or two things that will help us in our taking precautions, especially in this time of COVID. And following Mr. Mariwangu is none other than Dr. Chireka, who is going to take us through maybe some of the things that we may need to be doing to help us, as Mr. Mariwangu said, that we are exposing ourselves more to the risk environment unnecessarily. So over to you, Dr. Chireka.
Before
you allow me to share this, it's saying what's disabled, attend the screen sharing. If you could go to settings and allow me to share, please.
Is it allowing you to share at the moment? I think
No.
It's not, okay. All right. So I will make you the host, and when you're finished, you can bring it back to me.
All right, let's see.
Right, let me see. I can get you down there. Right. Over to you.
Okay, let me see if it's yeah, it's allowing me. Okay.
Just bear with us when the wireless is getting ready.
Okay, so thank you very much, everyone, for this opportunity, and thank you, Mr. Mariwangu, for your experience that you've given us. It's good that allow me. I apologize. I may be using your experience to highlight. And it's also good to have somebody that has gone through the disease and shared with us. So I'm really pleased, and I hope you don't mind that I will make reference to you, to your very detailed explanation that you've given us. So what I'm looking at, what can we do to fight COVID-19 among our community in the United Kingdom? And I know you've touched on some issues which I'm also going to expand on. I just want us to look at the statistics. When you look at statistics, it's quite revealing something. When you look at the Black Caribbean, were per 100,000, 78 people per 100,000. Other blacks is 53. And then let us look at white British. If you look at white British, you look at 37. If you look at black Africans, we are at 30 in terms of hospital deaths. So you can actually see that if you look at Black Caribbean, other blacks, Black Africans, we are dying in large numbers when you look at these figures. And then one interesting thing that I've looked at, they've looked at in terms of death. If you look at death in the least deprived, places like Weybridge, Surrey, the rich people there. And then you look at Brixton, people, places like the most deprived, you find that COVID deaths are high in those areas. And then when you look at who live in those most deprived areas, you find that it's the BAME community that lives there. So that's one thing that statistics are telling us. And then when you look at critical ill patients by ethnicity, who are those people that are actually needing hospitalization, going into the intensive care unit? You find that they have found that Asians and Black people are actually on the higher side. We are getting to these places in higher numbers. And then when you look at the likelihood of us dying as compared to our white counterparts, we are finding that we are 4 times more likely to die if we are from the Black community. These are the statistics that are in front of us. But now, the one thing which they have looked at, I want us to go to the bottom and look at, they say the corona death rate for pre-existing conditions. The people that have died who don't have an underlying medical condition, 0.9%, which is less than 1%. So what is being found that everyone who has died from has had an underlying condition, high blood pressure, diabetes, heart condition, chronic respiratory disease, or cancer. But those with fit, like Mr. Mwarwangu, they have not died, they survived. So we can actually see from this. It's telling us that people that they don't have any about Mr. Mwarwangu, it told us that he's a fit man, he was running, was doing all this. It does not say that when you're fit, you don't get sick. You may get sick, but the way you deal with the condition, it won't be catastrophe. It won't be a death in most cases. You will fight it in a different way. So that's why you have to look at that. It's 0.9% of those people that have died. So this is what is happening in statistics that we are getting. And also, you go to other statistics coming from America, the same story again. The people that were hospitalized, 56% of the people had hypertension. I want one other thing that we mustn't forget: obesity. Look at in America, obesity. In America, they've got the Big Mac, and we know what Big Mac does, and end up having people being obese. And the 52% of the people that were admitted had obesity, which is a BMI above 40. That's really cause for concern. Cardiovascular problems, chronic lung disease, renal disease, asthma. So we can find that these are the people that are getting admitted because of their underlying medical problems. I just want to talk about high blood pressure. Well, why is the high blood pressure? If you look back, high blood pressure was on the highest then. And then why would high blood pressure cause problems? High blood pressure is a silent killer. We don't have symptoms of high blood pressure. We get diagnosed with high blood pressure only when we go for routine checks. Maybe we've gone for health checks, or maybe for medical, for new employment, and then that's when people find that you've got high blood pressure. If you start getting symptoms of high blood pressure, then it means it has gone too far. For example, starting having a headache, and then, but in most cases, people will present with either heart attack or the high blood pressure. So I want to go back to high blood pressure. What does it cause? It causes other problems like kidney problems, like heart disease, like stroke, and then also dementia. So that's why you find that people that have high blood pressure, they'll end up succumbing or having stroke, high heart disease, because what happens is that the heart will continue pumping against high pressure, continue pumping against high blood pressure, up to an extent whereby it fails. Then you've got heart failure due to high blood pressure. And also your kidneys will end up failing and also having renal failure. And also because of the bleeding and also the problem with stroke and what we call minor stroke or TIA, you end up having vascular dementia. Vascular dementia is whereby you've got memory problems due to the damage of your brain, and it's mostly due to the small bleeds that happens in your brain, and it's due to high blood pressure. So high blood pressure is one thing that we mustn't forget, but I know a lot of us, we've got high blood pressure and we don't know about it. So my take-home message to everyone who is listening to this, please do not, you should know your blood pressure. We've got 30 people in this Zoom meeting. I want all of us to make sure that by tomorrow we know our blood pressure. By knowing our blood pressure, we are reducing our risk of getting all these problems. And also, if we get COVID, we will not be needing admission, we will not end up having complications. So this is the message that I'm saying, that let's fight this COVID by being empowered, by knowing what we can do. So in terms of COVID, what has been found, there are people who have been found to be vulnerable. People who are at high risk of getting a severe form of COVID. So people who are above the age of 65, and also people who are now in the nursing homes. But they have been found that people with lung disease or people with asthma, they do get a serious problem with COVID when they get it. And also people that are immunocompromised. What can cause immunocompromise? You may be on cancer treatment. If you're on active cancer treatment, your immunity may be affected. People who smoke, bone marrow or organ transplantation, some other people with immunodeficiencies. And also here we need to get it right. Poorly controlled HIV. So if you're on treatment for HIV and your viral load is undetectable, you are not at a high risk in such. But what we found that most people, some of us, are not taking their medication on a regular basis. And what happens is that their HIV is not well controlled. So when we talk about HIV, we are as a risk factor, we are not talking of somebody who has got undetectable viral load. We are talking of people that have that are poorly controlled, that their viral load is high, their CD4 count is lower. Those are the people that will be at high risk. And also people that are on prolonged corticosteroid steroids. If you're on steroids, for example, you're asthmatic and you're always needing steroids, or you've got Crohn's disease, you need steroids, or you've got arthritis and you're needing to be on steroids. So for whatever reason, or Addison disease, and you are on long-term steroids, then it means you're at high risk. And then, as you can see there, people with severe obesity, BMI of 40 or above, we are also at high risk. People with diabetes, you can be at high risk. But with diabetes, it's only also poorly controlled diabetes. So you need that. And then people with chronic kidney disease, those who are going dialysis, and then people with liver. So for diabetes, if your diabetes is well controlled, you are not at high risk. I will share with you these slides. I will give Mr. Nigodora the slides so that you can see them if you can't see them properly. Then if you are under this category, what are we saying now? So we are saying if you're one of these people with these symptoms, with these conditions, our advice, stay home if possible, exercise high hygienic standards, and then avoid contact with other people. Make sure that you are always washing your hands, cleaning and disinfecting surfaces, all those things. That's what we advise you to be doing. Now, most of us, we are workers, most of us, we are frontline staff. And there's one thing that Mr. Mwawangu did mention, and which pains me when I hear people talking about. He said the people that were looking after him were black nurses. The people that were looking after him were agent staff. The people that were looking after him were locum staff. We know what happens when you are locum staff. It means you go to the ward, maybe you're running late, you don't get proper handover, and you are told, yes, you are looking after Mr. Marwang. There's no training that you're given on donning and doffing of PPE. What do you mean by that? You're not trained on how to put on the gowns, the mask. What we have found that if you are not trained, you may self-infect You may infect yourself. How do you infect yourself? You infect yourself when you are now removing that PPE. Because if you go into the ward with COVID patients, it means the coronavirus will get onto your mask, onto your apron, onto your gloves. So if you don't know how to remove properly, it means as you are removing that, you are now taking all the viruses into your body, into your other parts, and then you infect yourself. So you need to be trained properly. And also the number of hours you spend in a COVID ward will also put you at high risk of getting infection, because the viral load in a COVID ward, where there are about 20 or 10 or 15 patients with COVID-19, then you are spending 12 hours in that. What people are recommending, they recommend that you should not spend more than 6 hours in that ward. But we know most of us, we take long shifts, we want to take 12 hours in that ward. So this is where we know that you cannot concentrate for 12 hours in a ward like that. So what needs to be done is that everyone must sit down with their employers to have what we call a risk assessment, a workplace risk assessment. So they do a workplace assessment. Okay, this ward is a COVID ward. What should happen in that ward? We know it's infectious. We know there are people who, and then now, as an individual, we assess you. You are Brighton. Okay, so Brighton, what do you have? So we say, okay, you are from the BEM community. Okay, fine. Brighton, you've got hypertension. 2. Brighton, you are male. Yes. Brighton, you are 50 years, 60 years old. We start scoring you. And then we see whether you are fit to go into that ward. But sadly, this does not happen to our people who are working as locum or as agents. You are told by your agents to go to Homerton, and then you go there, you are put in a ward, and then you go and work them without this risk assessment being done. But we are recommending that this risk assessment be done on everyone who is working in the NHS. You mustn't go to work without having this risk assessment being done. Because if you don't have this risk assessment being done, you are putting your life at risk. We will not have any excuse if we allow to just go into the battlefield without having all the ammunition that we need. So now, this is the risk assessment that we are using. So we'll be scoring you. So we look at the age. If your age is below 49, we'll give you 1 score. If your age is between 50 and 59, we'll give you 2 points. If your age is between 60 and 69, we'll give you 3. The moment you are 70 years old, we're giving you 4. I just want to go further and now come back to this slide. So if you are below 6, you can continue working. The moment you go above 6, you are going into you mustn't be working in a COVID ward. So already you are seeing if you are 70 years, we'll give you 4 points. So it means you are left with only 2. If you go, so if your gender now, if you are black male, we give you 3 points. So already 70 years male should not be working in a COVID ward. This is what we need to do when we use this risk assessment tools. It tells you that before we even look at your underlying problems, we're just saying you are a male black person, age 70. So for 70 years, we give you 4. For your gender, we give you 3. So you've got 7 points. So you can't work in the COVID ward. Okay, so when we go now to look at your underlying problems, if there's no underlying problem, no non-health condition is described on this, we just give you a point there. If it is mild, well controlled, we'll give you 1. If it is not well controlled, we'll give you 2 mild, then here we'll give you 3. If you are pregnant, we'll give you 4. So you can actually see the moment a person is pregnant, they're actually at high risk. So if you are pregnant and you are black female, so pregnant black female, you've already 7. 4 plus 3 is 7. So what I'm trying to show you is that when you use such risk tools, you can actually find that we are putting our lives at risk by working. So if I ask most of us, none of us has heard these tools being used on them. But we are now recommending that I'll share with you this, then do your own assessment, and then I'll take it to your employer to say, I've done my assessment, I'm actually at 7, or I'm actually at 16, I'm actually at this number. So now, when you are in categories between 1 and 6, we say continue working in the current environment, but read the smaller print, following all safety precautions. Even if you are fit to work in a COVID ward, we are saying you have to follow all the safety precautions. What are the safety precautions? The safety precautions are that you should be trained on how to put on your PPE. You should be trained how to remove the PPE. You should have adequate PPE. What is PPE? It's personal protective equipment. That's PPE. So you should have that. You should be trained on how to use it. And also you should have regular breaks. You should not work more hours. All these things will go for category A. Even if we say you are fit to work in that ward. When we go to category B, we say you must avoid contact with cohorts, especially who have got COVID, category B. If you have got category C, score 9, we say you should contact your occupational health manager so that you can do home working or to be moved into somewhere else where you'll be back, where you can't have contact with people, where you can do paperwork or work from home when you're category C. And one other thing that I need us to understand, when we talk of, this is a slide from the Royal College of Midwifery, where they are talking that if a person is not suspected of COVID-19, what I like about what they're saying, you should be washing your hands, you should use gloves, you should have a mask, you should have an apron. This is someone with no COVID. You are not suspecting COVID. So you are asked to use all these things. This is what I find that some people will tell you, oh, I work as a mental health nurse, and we don't have any PPE that we are wearing, because our patients, we don't suspect them to have the COVID-19. The message, the take-home message to everyone today is that everyone is positive for COVID until proved otherwise. They do not have to. They do not have to have symptoms for you to say they've got COVID. Everyone that you are getting in contact with, whether in the street, whether at work, whether wherever, they've got COVID. If we start from that, then we will protect ourselves. That's why we have to clean our hands, wear gloves, face masks, and all that. And then now, when it goes to other areas, you start having gown, you start having goggles, you start having visors to use for confirm the cases. So my message home is that you should not, whilst we're in this pandemic, there's no need, you should not work without wearing some form of personal protective equipment. You mustn't work with your bare hands, with no face mask, with no apron or a gown. So I just want to conclude by, this has been said by Mr. Mwarwangu already. Our health being, health and well-being, when we are so far isolating, or whenever we are, whatever we are doing, this does not need for you to be so far isolating for you to start practicing this. Eating well and staying hydrated. We must make sure that we are eating healthily, more fruits, more vegetables, more water, less processed meat, and we need to drink more fluids so that we stay hydrated. What should we be looking at? We look at our urine. Don't wait for thirsty. By the time you get thirsty, you're already 5% dehydrated. The only way to look at your level of dehydration, to look at your urine. The moment your urine is getting a bit orange, yellow, then you're getting dehydrated. Your urine should be ideally looking like water. And I know most of us, 99% of us, we don't have urine like that. Most of our urine is actually orange, yellow. So we need to be, that's why we find ourselves having severe headache, feeling tired, not concentrating, dizziness, all that. It's lack of fluids. So we need to make sure that we are drinking enough. The reason why I'm using the word fluid, I don't want to go into this debate about should I drink water, should I drink whatever. My message to you is fluid. Some people can drink tea, tea is fine, but coffee is not good because of the caffeine. Juices are not good because of too much sugars in them. So that's why people end up saying water, 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 water. So it's better to go for water, but I'm just using the term fluid. Well, some people will tell you, I drink tea without sugar. Is that a problem? No, it's not a problem. Drink as much as you like. But for coffee, there's a problem there. Then limit the amount you spend watching, reading news, whatever. Okay. Sometimes there can be what we call information overload. You may end up panicking and all that. But I know Mr. Morwang was very looking at research and all this, but there's also a danger that you may get these conspiracy theories which may scare you. And then you need to stay connected to loved ones. So we must connect. Loneliness is dangerous. Loneliness can actually kill us. Loneliness is dangerous. So we need to make sure that we are connected, contacting one another. So I think as a community, we must make sure that we are following each other, finding how someone is feeling. If we hear someone is not well, let us keep in touch with them. For example, as Zai, we are not only for agriculture, but we are there for the well-being of each other. And I want to thank your leadership, Mr. Tugodora, for having such a platform where we can actually share, because at the end of the day, what benefit is to Zai when all of us are now in hospital or when all of us have died. So it's not benefiting anyone. But when we are fit, when we are well, we can also actually achieve the objectives of Zai. So we need to stay active and plan home workouts using other apps, and then practice mindfulness. Mindfulness is whereby you are now reflecting and thinking and seeing things on the positive side. It's a big topic to talk about mindfulness. So I don't have the time to talk about now. Then try to keep a routine. Yes, learn something new, such as a new language, find a hobby to do if you are in self-like isolating. Online, there are several free online courses that are being done, so you can do that. And then how to spend your time, watch uplifting films, listen to podcasts, talk up on books, use the time to do jobs that you don't normally have time to do, play cards, all this, do a lot. And then this is my last slide, you'll be pleased to hear, where I'm saying self-care can't be selfish. So we need to be compassionate to ourselves. For you as a worker to be able to give to other people, you must also be full. The moment you are running on an empty tank, it means you will not be able to give that tender love, care to your patient, to your wherever you are looking after. So we must also make sure that we are also fit ourselves, because overworking, lack of sleep, not eating healthily, not going to see our doctors, not taking care of our medical conditions like high blood pressure, asthma, heart failure, stroke, HIV, all those underlying conditions, diabetes. If we don't take good care of ourselves, COVID will just be someone triggering a gun that is full of bullets. Sometimes we are moving disasters because of underlying problems that we are neglecting, because of the overworking that we are doing, because of lack of due diligence that we are doing. We're just walking into a world without being trained. We're just walking into a world without being given proper PPE. We are walking into that world without underlying problems. We are walking there when we are tired. We are walking there when we are not eating properly. We are walking there when we are lacking vitamin D. We are not going outside to the sun, or we are not taking extra tablets of vitamin D. So these are things that we are putting ourselves on. And of course, there are other things that we hope the inquiry will look at. We need to speak up. We mustn't accept to be segregated. You must be given the PPE that is being given to everyone. You must be allocated to the award, which is the way the allocation should be equitable. It should be fair. And the challenge that you have, if you are agent staff, you may not have a say. But you need to know that if you're going to the COVID ward, you are fully equipped. You've got the necessary equipment. I'll stop here and I will leave it to the floor to ask further questions. Thank you very much.
Thank you very much, Dr. Chireka. That was very insightful and also informative. Our take home by tomorrow about this time, everybody who is on this call, 40 of us, we should know our blood pressure. And we must drink a lot of fluids. Water is advisable, but anything that can keep you hydrated. As this slide is saying, self-care is not being selfish. Look after yourself. Even when you go into the aeroplane, they say when there is a problem, you need to put your mask first so that you'll be able to help others. So if you can't take care of yourself, you will not be able to take care of those loved ones around you. I invite questions to Dr. Chireka. If you've got any question, if you raise your hand. Right. First one is from Dr. Chireka. You have not sent it back to me as the host, isn't it?
Oh, okay. Yeah, let me send it to you.
Thank you.
Okay. Yeah, make host. Yeah.
Thank you.
Yeah, I think I've returned to you. Thank you.
All right. Our first question is from Bishop Abraham. I've unmute you, I think. Right. If you can, are you able to unmute yourself, Bishop?
Yeah.
Yeah. Okay.
Thank you very much, Dr. Chireka. I came in a bit late. It was wonderful and great to hear all your medical advice as we are going through the crisis, particularly people from the BME group who became victims, and we empathize and sympathize with the families. But I thought maybe our people must also take into account social and economic environments. That most of the front line, including doctors, nurses, social workers, etc., all the social work staff, they don't have much choice in terms of choosing to say if they are a nurse, their choices are very limited. They may come late, usually they are early, but you find when they are there is a stigma and stereotyping to say this one is agency. And the full time, usually they don't pay attention much to agency staff, regardless that you are a professional, because it's a stigma that is there already. And because you are locum, your agency, or whatever your background is, and on top of that, you are from BME group, it becomes so challenging. But some of them, they just go in. They don't do the handover. It's just a sweeping handover. And then off they go because they're also stressed out. I think what we should also accept as BME group is that we are in a situation where we should not allow the stereotyping which the media is doing to say.
Let me just cut you a little bit, Bishop.
Yeah.
If you can ask your question precisely, then after we have gone through all our speakers, we can have time where we can.
Okay. I thought it's a contribution.
Just ask questions that are directed to what Dr. Chireka has shared.
Right. I've got a direct question to Dr. Chireka. That statistics is saying we have more BME group, that is Black and Asians, who are dying because of COVID-19. And particularly is happening in Great Britain and America. I have looked at a bit of statistics in Australia, New Zealand, and Canada. In some European countries, we don't have much statistics of the kind we are hearing here. Can you explain medically or either way why the two major countries, continent of America, North America, and Great Britain, we have more professionals who are dying because of COVID-19?
Thank you very much, Bishop, for your question. Your question is a bit complicated, and that's why you find that they are actually saying we're going to have an inquiry, we're going to have a review of a review. So, but we've got factors that we need to take into consideration. The factors that we take into consideration are the factors that you've raised already, that here in the United Kingdom, we know we've got nations that have left United Kingdom to go to Canada, to go to Australia, to go to New Zealand. Why? Because they get better pay, they get a better packaging. Here, if we work in the NHS, we don't get paid enough. So what do? We work with agencies. And what do? We form our own companies. And what happens? We are segregated. There is natural segregation of a locum. There's natural segregation of someone who's coming from agency. It's not about black or white. It's about just, there's one segregation just because you're a locum. Segregation just because you are not part of the family. You are an outsider. You're only coming for a day. So that also puts you at a disadvantage. And also, if you are black, then there's also subconscious racism that is there. So you are hit by two things that puts you into that category. And also, the other problem that we do is ourselves. Sometimes we are also not accepted. We go into a world without PPE just because you are afraid that the agents want to give you shifts. Also, you're afraid that if you don't go, if you don't work, you don't have anything to feed your family at home, then you put yourself at high risk. So these are the things that we are looking at, paying them a reasonable amount of money. And also we are saying, why would them be asked to pay 2,000 just to renew their visa? 2,000 is a lot, it's a lot of money. Ask even people working in the NHS, the white people, to say, do you have 2,000 saved in your account? You'll be told, no, they've got the credit cards. They cannot afford to have 2,000 in reserve. But we are forced to have that for to renew our passports, to do whatever, to bring people from Zimbabwe, whatever. So we are already disadvantaged. So what do? We end up overworking. And we are working into dangerous zones. If you go at the battlefield, at the front, without any equipment, we'll die. This is what is happening. So it's not our fault per se. But then that's why we are saying, can you have risk assessment of the workplace? Can you also look at yourself? Are you fit to go to the battle? Are you also equipped? These are all the things. So it's a complicated, not a one problem. It's so many factors that we need to look at to make sure. But you can actually see that it's not that we are weak genetically. How can we be weak here when in Canada we are safe? In Australia we are safe. In New Zealand we are safe. In Zimbabwe we are safe. So it shows you that because of the environment we are in.
Thank you very much, Mr. Banegari. Wanted to have got a question.
Yeah, thank you, Doctor. I just wanted to clarify something. You know, on the underlying conditions like hypertension, diabetes, and heart conditions. Is it mainly genetic, or do you think it's just due to socioeconomic or activities or lifestyles? Why is it more prevalent in the Black community?
Yeah, so the interesting thing, I watched the research done by Dr. Williams, a very guru in America. What he said and what we know is that lack of sleep increases your chance of getting diabetes, increases your chance of getting high blood pressure. Also, poor air quality, where you are living. If it's congested, dusty, industrial, it also increases your chance of asthma, COPD, the chance of diabetes, the chance of high blood pressure. And also, if you are not eating properly, the lifestyle you're relying on foods, takeaways, you also have got problems. You're lacking vitamin D, you also have got all the chronic conditions coming. So it is a pile up of all these factors on Black people. So that's why you find out we have high rates of diabetes, high rates of blood pressure, and also by that nature, that it was our lifestyle chaotic. We don't even go to the doctors. We don't even take good care of ourselves. Because if we are able to eat healthfully and rest and do this, we will not get these diseases. And also, if we get those diseases, we'll be able to go to see our doctors. But just because we've got them, because we are not having time, we are overworking, that means we won't have time to go and get treated. So yes, it is lifestyle. Yes, it is the environment. Yes, it is some of the policies in this country that are also putting ourselves in that. And yes, we end up having all these conditions.
Thank you very much. And we have got Mr. Chibue.
Thank you very much, Dr. Chireka, for your presentation. Unfortunately, I came in a little bit late, but what I did notice was that your presentation was more or less geared towards those guys who are in the health industry, who are healthcare officials. Do you have some sort of template or risk assessment that we can also apply in our general workplaces? Because as we go back to work, I think it's very important to assume that this thing is going to be with us for some time. And we really need to be able to constantly look at the risk wherever it is that we're working and address those risks.
Yeah, so this risk tool that I've given you, it's not for NHS. It is for all key workers who are going to be working in an environment where you're in contact with other people. But if you work in the office, then you are protected. But if you work where you're going to be interacting, for example, you work for the railway, you work in a shop, you work in all these other where you're interacting with people, yes, you have to use this one. Because we are saying everyone is COVID positive. So then what it means is that everyone, when you're going back to work, the Faculty of Occupational Medicine has put up this tool. This tool that I was sharing with you is from the Faculty of Occupational Medicine. And it covers everyone, all employees, all employers. So yes, you can use this for yourself as well. Because it says workplace assessment and workforce assessment. It means you're looking at your workplace. Is there any chance that you would get COVID from your workplace? If the answer is yes, okay. What about, are you fit to be working? And then you do an assessment of yourself. So it's the workplace and the workforce that need to be assessed. So it's not only the NHS, but I was just using the NHS because of all the sadly publicity that we have got from the people that have died. And I know a lot of people in the healthcare system that have died. I know people that work for the railways who have died. So yes, we should be using this for everyone.
Thank you. I think in the interest of time, I will ask Aisha to ask a question, then we can move to our next presenter. Aisha?
Hello, yeah, thank you very much. My question really that I wanted to ask was with regards to the underlying conditions, are these pre-existing underlying conditions, or are we actually recording cases whereby an individual ends up in hospital and an underlying condition is yet then discovered at that stage? Or are we just looking at just purely pre-existing conditions that the individual would have had months or weeks beforehand?
Yeah, that's a good question. We don't have the statistics to say these underlying conditions were they there before or they are coming in now. But what we know is that most of the people they've been there, but they were not being diagnosed. Because when we check for blood sugar, we find your blood sugar very high, and then we look at things that check whether you've had this for 3 months. If it is high, then it's telling us that this has been ongoing. When we see you having high blood pressure, and then we look at some other complications of high blood pressure, when we see those complications in yourself, then we can see this has been a long-standing condition. But there's no one who has come up with the statistics to say these people with high blood pressure, 50% they did before, or 50% did it for 1 month or 2 months. No one has got that data, and it's a bit challenging to get that data as well.
Thank you very much, Dr. Chireka. It has been very eye-opening information you are sharing with us, and the tips for better living. We have got a finance expert among us, Mr. Chipato, who started working in the finance with the Ernst & Young in Zimbabwe, and he has worked with a couple of companies doing their accounts, and he has got his own consultants company. So he's here to share with us as we go through COVID-19. We need to be financially sound and also prepare ourselves post-COVID, so that how do we make ourselves financially sound during and then after COVID. So I give it to you, Mr. Chipato.
Thank you, Mr. Chugolora. Good evening, everyone, and thank you for inviting me on this platform. I wouldn't so much say as I'm coming in as an expert in finances, but we are here to obviously share ideas and our experiences. And I thank Dr. Chireka for that insightful presentation, because this, to me, this pandemic is akin to one's house being struck by lightning, but not being destroyed. It serves as a warning. And there's obviously so much talk about ethnic minorities and how this pandemic affects us. And I would say, over and above the underlying conditions, one of the major conditions that affects us as minority in these communities is our standing in finances, the opportunities that are presented to us. Just a bit of background about myself. I work for Ernst & Young in Harare, and did quite a few audits around the country. Moved over to England, and worked in several companies, and now I've got a small business that I'm doing. Basically, it's finance, accounting, tax. I do a lot of tax returns and self-assessments for a lot of nurses and healthcare workers. With regards to finances, obviously, with the storm that has just hit, a lot of businesses are going to go under, and some are already struggling, and the government has obviously put in place the furlough system. Now, it's a good thing if we are able to go to work and keep the income going. But then there's also some of the members of our communities whose businesses were completely shut down, or some of them that were self-employed and are having to resort to the furlough system of the government. And the question is, from this point onwards, how do we move forward as a people? You know, this afternoon I had a small chat with my friend Mr. Chugolora, when I said the problem with a lot of us is when we left our country to come here, it sort of didn't solve the problem. if anything, it created another problem, because when we moved to this country, it basically meant we are running two families. We've got one in Zimbabwe and we've got another one here. Here you have to look after yourself, but then again, back home, there are people who are looking to you to sustain them. And the problem seems to have been escalated now, because we have spoken about the socio-economic environment that is contributing to this pandemic. And if you worry about your next meal, if you worry about where you're going to sleep, if you worry where your next change is going to come from, obviously that will contribute to your health. Like Dr. Cherek has just mentioned about hypertension, blood pressure, eating habits, exercises. You need a healthy body. A healthy mind, results in a healthy body. I don't know exactly how the saying goes. So briefly, I would say, or maybe I would ask us here and the wider community, BME community, what is it that we can do to achieve financial stability or financial sustainability? And from the businesses that I'm running, I have set up. It's a little charity. I know most of us frontline key workers, because of what I've mentioned about having to, sustain two households. I've set up a little charity where I train young kids in bookkeeping, the basics of numbers, bookkeeping, accounts, and I felt that as a community, if we come together, if we put our heads together and help each other out, that could take us forward financially. Because I don't see, I'm sorry if I sound a bit pessimistic, but I struggle to see us getting out of this unless we as a community begin to learn to create wealth for us and our children. So until such a time when we get to a point where we don't only go to work for the next paycheck, but we start putting in place measures, ideas, we start feeding into our kids, we start feeding into our communities ways and means of creating that bit of wealth that we can put aside, that when a pandemic like this hits, we are not all wiped out. So it's not necessarily things like, I want to open up a law firm, or I want to open up an accounting firm. There's lots of things that we can do to generate income. We can pool our resources together. We can start off. We've got ladies in our own community here. They've started a charity where they teach kids how to knit, how to bake, how to sew. And these charities get funding, from the various organizations. So my message basically is not so much that I've got the magic 6 numbers for the lottery, then boom, we're all rich tomorrow. But I try and encourage us to find ways and means to create wealth, and from that wealth, we can get our kids to take it forward. I'm also a member of another group that's it's actually started it's bringing basically farmers, or those that are interested in farming. Some of us have never owned a farm before, but I've learned quite a lot, and my desire to even try my hand out in a bit of farming has been heightened by that. Those are all ways. So basically, for me, it's not so much of me giving you financial advice, but it's a way of bringing us as a community and saying, hey, look, guys, we've been working for other people for however long I can remember. Yeah. But then what happens if those people that we depend on for our sustainability wake up one morning and say, look, this pandemic has wiped out my business, so I'm unable to employ you? What do we do? So my message basically is, if we can come together, put our heads together, and create wealth. Let's create wealth. Let's plan for the next 100 years. Let's not plan for the next 5 years, but for the next 100 years, so that we are, whatever we create today, our children will be able to take it forward and run with it, so that if another pandemic like this hits, you know, we are not shaken or decimated as a community. Thank you.
Thank you very much, Mr. Chipato, for that awareness into how we should look at our finances, and particularly look at creating wealth, creating business that will sustain us, not looking just for tomorrow, but looking at generations to come. I will invite questions to Mr. Chipato. Mr. Nera.
Thank you, Mr. Chipato, for that, for sharing with us, you know, very valuable information on the financial impact of COVID-19. My question to you is on agency or local workers. Are they eligible for the COVID-19 job retention scheme?
Well, basically that the job retention scheme is between you and your employer. If you are, because when you go into work, it's either you are employed or you are self-employed. If you're self-employed, then you are eligible for the grants that the governments are giving out.
Mm-hmm.
If your agency, you are eligible. If you're employed, you are eligible for the job retention scheme that the government has rolled out. It's basically two categories. So if you're self-employed, there is a scheme for the self-employed, and I think the government has actually extended that, because it was initially meant to last 3 months. I think they've just extended that most recently. So you are eligible for the job retention.
Thank you.
Any other question to Mr. Chipato? Tsitsi?
Mine is just, I don't know whether it's directed to you only or is directed to both of the speakers. I know Dr. Shureka and you have been having conducting some talks to our, ethnic minority people. Is there any plan of having us helping each other? For example, there are a lot of nurses who have been working with agency who are going to be affected. The reason why some are not resting is because they won't have anyone to help them paying their mortgage, paying some they've bought, they've taken cars on hire purchase. So they don't have, they don't know what to do. Is there anything which we as a community are planning to do so that we help, even if it's a food bank, like what other communities are doing, or there's nothing? To both of you, our speakers.
Okay. If I can, in terms of, I know in terms of mortgages, a lot of the mortgage lenders have they've introduced the mortgage holiday. Also, it basically means you're given a period where you're not paying your mortgage for, is it for the next 3-4 months? And the second part of your question regarding what the community is doing, I think this is where my last bit of the presentation was, that as a community, we need to take this as a warning. You know, we've been caught unawares now. So what are we doing? So if next time this hits and part of our community or a member of our community is vulnerable, what are we as a community able to do to cover those that are unable to do it? This is where my plea was, that if we could start maybe coming together, and through platforms like this, we create and organize ourselves into units that, you know, we know what is happening with our members within us. Some of us or some of our members may not need even food or whatever, but just a simple hello, just checking on each other. You know, it's very important, because let's face it, we are all different. Some people are quite happy to come out and say, listen, I've got this problem, whereas others are not so free. You know, some people would want to keep that in them, and it will be it's very interesting that we've got a lot of social workers, nurses, and people. They have the expertise to talk to people and get to find them and befriend them, because only that way, once we come together, can we really know what's affecting us as a community.
Thank you very much. There's a question from Marcia. She wanted to know, how does kids join the charity on bookkeeping?
What I can do, Mr. Chigodora, I will give you my, I will send you my form, which you can, whoever is interested, you can send that to them, and they can just basically fill it out and send it back to me. So I register them on my system.
Thank you very much. Any more question? Or Dr. Chireka, did you have any response to this question?
Yeah, I think I totally agree with what Mr. Spato is saying, that as a community, we are reactive, not proactive. I think as a community, we should be able to look that and understand that we may have challenges in the future. But when you look at our community, also there are some issues which also discourage people. Because when you look at funeral arrangement, there have been some bad experiences where people have lost their money, but they were actually paying insurance for their loved ones, so which is just discouraging people from joining these activities. But of course, they are also good, like the diaspora funeral. I don't want to campaign for them. They are also doing a good job. So there are some who are doing a good job. So we should not give up just because one or two people have taken our money away. We need to make sure that we've got systems and financial policies which are robust, which will protect our funds. The problem that we do is we do a gentleman's agreement, nothing is written, no legal document, and then tomorrow we cry. That's not good. We just need to make sure that we put everything in place. We have got our papers done. No one who, can walk away with money, and no one was able to take money on his own. We have got company laws which where no one takes money away. How do somebody take money away when not affect? It should be 3 or 4 people signing, and how do they do that without our knowledge? There should be a way of saying, well, we have to agree for a certain amount of money. So those are things that we should be checking, and then we should be asking for a bank statement on a regular basis. So those are things that as a community we need to be doing, and then support one another. What I've found is that I just want to maintain myself on one area where I know more, is just getting people and talking about health. The moment we start to talk to people about raising funds and all that, you lose a lot of people. So that's why I've sort of given up on raising funds. I want to leave it to people like Mr. Pato to help us, to guide us, and then we'll support them.
Thank you very much. We can have any question to any one of our presenters, or if you have got anything that you think can help us as a community, you can raise your hand and share. Mr. Chipato?
Yes, my one is to Dr. Chareka, and the slides that you're presenting, Doctor, are they available to members of the group? Because information is key. You know, you shared some stuff there that I'm baffled. I'm beginning to wonder now. There was a period where I wasn't feeling too well for 2 weeks. Was it COVID? Was it not now? So if I could get a hold of those slides, I'd be grateful.
Oh yes, this slide that I've shared today, I will be sharing them with Mr. Chigodora, and I've put my email address. Feel free. And then every Wednesday between 7 p.m. and 9 p.m. we are having discussions with a Zoom where we meet all health workers. But I think when you attend it, you realize that it's not for health workers, because issues that are being discussed there are just general, and that's how we can support one another. And then it also gives you a perspective of how our people are suffering at workplaces, how they're being discriminated, and all that. So we have for those every Tuesday. And this Saturday we are having a webinar where we are going to go through mental health. This week is called Mental Health Awareness Week. So we are trying to just raise this, because we know we rarely talk about mental health. And a lot of our people are suffering in silence. They are depressed, they are stressed, and we know that people with depression or with stress, they also have got they are at high risk of getting diabetes, of getting blood pressure, of getting all these other chronic illnesses. So you can see there are so many things going against us. Then when people say, oh, black people have got high blood pressure, they don't understand that if you will put them in our shoes, they will not be able to walk.
Right.
Thank you very much. Anyone who has got a general comment or question, briefly? That's it. We can't hear you, isn't it?
Yeah, we can't hear.
Can't hear. Maybe. We can't hear.
Not on mute on my side.
Are you mute on your side?
No.
So but we are now hearing you.
Okay. I was saying, Dr. Shureka, you mentioned about checking our urine. And I wanted to just add also that, is it important also to check our stool? The question is, I've heard some people saying, some people are presenting internal bleeding. COVID is presenting, internal bleeding, which I think can be identified by inspecting one's stool. Is that correct, or?
Yeah, I think there is issue about the what we call pathophysiology, or what happens, the damage that happens when you get COVID. What has been found is that it's not the bleeding. What has been found is that the clotting. So people with lung problems, people with respiratory failure, there is an element of that they are getting some blood clots in the lungs. So that's why people are also saying that part of the treatment for those people that are needing ventilation and what have you, before they are put on ventilation, they should get oxygen and they should get blood thinning tablets. So that is one of the things. But now when it comes to checking your stool for any bleeding, no, there's no evidence of that effectiveness. And COVID wouldn't cause you to bleed. It would cause you to actually get clots, blood clots. That's your blood clots, not bleeding. So it wouldn't help much.
Okay, thank you.
Right. Fungai.
Hello. Yeah, mine is just a comment to Mr. Mwarwangu. Just to say thank you for your courage and for sharing your experiences with us. I think you've highlighted a lot of important things that we take for granted about keeping ourselves fit and also listening and understanding your own body. So I think it's quite important that we understand our own bodies to know if and when we get unusual symptoms, and also the fact that we should keep hydrating ourselves and keep healthy, try to eat good food and exercising. So thank you very much for your sharing your experiences with us.
Mr. Nera.
Thank you, Mr. Chigodora and the design board. I just want to register my profound gratitude to this intervention that we have arranged, because personally I find it very informative and very relevant, because it doesn't matter who you are, it doesn't matter what you're doing. The COVID pandemic has really impacted in one way or the other. So I want to say to Ms. Chigodora and the SAI board, thank you very much for arranging this intervention. I shall not repeat what Brother Fungai has already said about Mr. Mariwangu's courage. Thank you very much, Mr. Mariwangu. Dr. Shreka, very informative slides, and I do agree with Ms. Chipato that if that information can be disseminated to as many of our Zimbabwean communities as possible, that will indeed go a long way in helping us to take heed or to take appropriate action regarding COVID-19. Somebody once said that it is easier to know something about everything than to know everything about something. So it's very important to sit down together and share information. More so, if we can act, we have been given very valuable information today, but what makes the difference is the action. The information that we have got today, if we can discuss at family or unit level to share that information and to take action, real practical action on that. On the contribution by Mr. Chipato regarding the community resource mobilization in terms of finances, I think we now need a model. We need guidance on a model of community resource mobilization, because other communities in this country or this part of the world are being very successful in resource mobilization as communities. We are very good at helping our own communities back home, but sometimes we do forget ourselves. I think we need to come up with a strategy on community resource mobilization. Maybe ZAI as a community interest company, if it is still, I'm just wondering whether it could actually be used as a model of resource mobilization. But I think the guidance from the likes of Ms. Chipato will go a long way to actually, give direction on that matter. But thank you so much. I just wish to register my gratitude. Thank you. Thank you, ladies and gentlemen.
Thank you very much. Editor,
thank you so much, Mr. Chigodora and your team. And I also want to thank Mr. Chireka, Mr. Mwaruwangu, and Mr. Chipato for coming onto the platform and to share with us such valuable information. We really need it as a community. Now, from where I am standing, I'm just sort of looking at us as a diaspora. I think we have already some processes, we just don't seem to come together very well as a team. And I think that's one of the things we need to learn from COVID, that we have capacity, we have the knowledge, we have the skills, but maybe we are putting efforts in the wrong direction. We can't get rich digging another man's hole. So we need to start thinking about ourselves, our families, especially for those who have lost their loved ones. That could happen to any of us. And that's something that I personally have said to myself, I can't feed everybody at home. Maybe I need to start thinking about me, my children, and then if we still have, then think about the people at home, because they're much better at this point in time than we are ourselves. So let's look, one, from where Mr. Chipat was saying, moving forward, what if the doors close? Where do we find ourselves? So that's a very important question. This is where we were having a meal. What if that door closes? So I just want us to think around that. What do we do? Thank you.
Thank you very much, Mr. Mwaruwangu.
What I would want here to say is, from my own experience, listening to what Dr. said and also what Mr. Chipato said, I would start with what was shared by Dr. Chireka. Because of the experience that I've gone through, I'm so much observant. I try to interact with those who have gone through the same experience and those who haven't. I've noted there's one thing that is lacking in our community. Just to do simple health checks is very important. There are a number of people who are just falling either at work, either at home or anywhere because of blood pressure. I have my nephew who is here in the UK. I was talking to him and he was in denial because he is slim. To him, he was thinking people with big bodies are the ones who can have blood pressure. And I was saying to him, it's better for you to go for a health check just to make sure you are okay. It took some time, but this past week he went and he was told he has got high blood pressure, which he is going through medication right now. So it's better for us just to learn from the environment that we are in. When we came from hot countries like Zimbabwe, we used to hear that vitamin D comes from the sun and this and that. We are not enjoying that as much as we should be here in this country. Personally, I didn't want to take tablets. That's my belief. I'm a Christian and I grew up believing that God can heal me. But I have come to realize it's good to take vitamin D, it's good to take vitamin C tablets because of this COVID. So let us keep on teaching each other. Then I'll move on to the issue of money. Recently at my workplace, a number of people left the company that I work for, going for locum posts. And then this disease struck. We were discussing at work that, hey, weigh your options where you are. What is best for you? If I wasn't working permanently, I could not have gone for 2 months, not going to work, being paid. Some people went to locum, but as soon they fell sick, they had to force themselves to go to work to earn a living. So wherever we are, let us weigh our options. What can be best for us? Then on community initiatives, there's a sense of, I can do it myself among Zimbabweans. We don't want to work as a community. I don't know what we can do to encourage each other so that we can work as a community. There are so many groups here of Zimbabwean communities, but it's difficult to come together and put one thing in place that can help our community. Baba.
Thank you very much. That was very insightful. First Zoom meeting for Zai, and we intend to make this a permanent feature. We will inform you as to how and how often when we go back and deliberate as a board. And I want to appreciate everybody that has taken time to come on the platform. We know we have got almost 40 centers of lightning where our community is going to be informed about the things that has been shared here. Some people may not have come, but because someone has been here, you will be able to go and share, and the effect goes on. Actually, responding to the concerns about the community as a initiate community coming into with a model, as a Zai, we are committed to work with any partners that can help us, like Mr. Chipato or with Dr. Churekas, so that we can come up with the robust and viable model that can encompass a lot of our communities. We are free for members. If you have not been a member of Zai, this is an opportunity to jump on this wagon. It's going places with the support of everybody that is around us. We are going far. So I appreciate everybody that has come on the platform. And as Dr. Chireka said, he's going to share the slide with me. And if you just get in touch with us, we will be able to forward them to you. And if you
That's enough now.
If you need to any more information, we are free. When we come up with another platform, which is going to be very soon, we will let you know, and you invite your friends. So thank you all for coming, and we appreciate your time. Thank you.
Thank you, everybody.
Thank you.
Thank you.
Thank you very much.
Thank you. Bye. Bye. Thank you.
Okay, bye.
Thank you. Bye-bye.